The City of Houston and Harris County will continue collaborating on a strategy to address monkeypox vaccines and testing for at-risk populations. It was a positive step by the World Health Organization to declare monkeypox a global public health emergency, and I want to assure you that the City of Houston and Harris County are taking this matter extremely seriously, recognizing that this is a public health emergency. We announced last Friday that the Houston Health Department received slightly over 5,000 doses of the monkeypox vaccine. The delivery of the doses allocated by the Center for Disease Control and Prevention and the Texas Department of State Health Services will allow more vaccines to become available for Houston and Harris County residents at the highest risk of the disease. The Health Department for the City of Houston kept about 3,500 doses and provided more than 1,500 doses to Harris County Public Health. It is a 2-dose series, 4 weeks apart, for prevention if someone has been exposed. It's best to start the series of vaccines within 4 days of exposure. As monkeypox cases continue to increase, it is extremely important that Houstonians know that the community threat level to the general population continues to remain low, but the number of cases in the Houston area is rising, and because of the limited supply of the vaccine, it is still very concerning. If you think you have monkeypox symptoms, please speak first with your doctor and get tested. The Houston Health Department announced the city's first confirmed case of monkeypox on June 18th. The case count rose gradually over the following weeks, and none of Houston's monkeypox cases, well, they would say at least one, has required hospitalization, and that was primarily for pain management. Houston currently has 47 confirmed cases. At least one has required hospitalization, and these persons are not severely ill, just isolating to avoid spreading the infection. However, this case count is likely to increase based on what we know has happened in other cities. Monkeypox is a rare virus and does not spread easily between people without close personal skin-to-skin contact. There is a limited supply from the Center for Disease Control and Prevention, the CDC, and widespread vaccination is not recommended at this time. Due to the limited national supply, the vaccine is not yet widely available to everyone. The focus of vaccine availability is people with a likely exposure to a confirmed monkeypox case. I will close by saying that the Houston Health Department is doing everything possible to increase the supply of vaccines. As Judge Hidalgo will mention shortly, we are sending a joint letter to the White House and CDC asking for more vaccines to meet the anticipated need of the Houston-Harris County region. And we need them to please send us more vaccines before the numbers exponentially increase. We are the 4th largest and the most diverse city in the country, and we need more vaccines. We all can learn from what happened in COVID. If you wait too long, then you're chasing after a pandemic. And in this case, we don't want to wait until the cases become so many that we find ourselves behind the 8 ball. So we are asking the CDC and the White House to send us more vaccines. Last week we received over 5,000. Hopefully in the next week or two we will receive at least that amount, if not more. I certainly want to acknowledge Europa Harris with Congresswoman Sheila Jackson Lee's office. I know I've been in communication with her, and she is doing everything she can to assist us as well. But Judge, thank you for your leadership. Look forward to working with you and with all of our health providers in making this happen. I know in addition to the City of Houston and sharing with Harris County, I know we're also making vaccines available to some of our partners as well. I had that list before me, but I'm sure Director Stephen Williams will mention this shortly. Thank you, Judge.